Today we shall be talking about neurologic scoliosis. So we're going to break it down step by step in simple language so you can understand exactly what it means, what causes it, how it is treated, and what to expect in the future for this kind of condition. So what is neurologic scoliosis? So scoliosis generally is a condition where the spine curves sideways. In neurologic scoliosis, the curve is caused by a problem with the nerves or the muscles that help support the spine. It's not a problem with the bones themselves, it's a problem with how the brain or the nerves and the muscles are communicating. So imagine the spine like a tall tower of blocks. Muscles and nerves help to keep it straight. But if there's a problem with the muscles or the nerves, the tower can start to lean to one side, and that is how neurologic scoliosis happens. What causes neurologic scoliosis? So neurologic scoliosis is usually linked to medical conditions that affect the brain, spinal cord, or the muscles. Some of the most common causes include things like cerebral palsy, we've talked about this here before, Duchenne muscular dystrophy, or other kinds of muscular dystrophy. It can be as a result of spinal bifida, spinal cord injury, genetic or neuromuscular disorders. So check out some of these videos that we've made in the past about these conditions, and you'll get more clarity. In these conditions, the muscles around the spine might be weak, they might be tight, or just unbalanced. Over time, this can cause the spine to curve sideways. How do we diagnose neurologic scoliosis? So we usually notice scoliosis during a physical examination. You might see uneven shoulders, the waist could be tilted, or there could be, or one side of the rib cage could be sticking out more than the other. So to confirm the diagnosis, your child usually gets an X-ray done. This helps measure the exact curve of the spine. It shows us the severity of the curve. Sometimes we might also order an MRI or refer your child to a neurologist, especially if the cause of the scoliosis isn't already known. Let's talk about how to treat neurologic scoliosis. So the treatment for neurologic scoliosis depends on a few things. One, we need to know your child's age. Two, the size and shape of the curve. 3, how fast the curve is changing. Here are some of the treatment options. One is bracing. So a brace might help slow down the curve as the child grows, but it won't reverse the curve, and it only works in some cases. Only certain cases can use bracing as the mode of management. What about physical therapy and supportive care? So physical therapy can help in the strengthening of muscles. It can help improve the posture and help reduce the stiffness of the muscles as well. So some children may also need special sitting or support to keep them comfortable and to prevent posture-related deformities. The third option is surgery. So in more severe cases, especially if the curve is getting worse or causing breathing problems, surgery may be recommended. This usually involves placing rods in the spine to help keep the spine straight, or at least as close to straight as possible. It's a bigger decision, and your child's orthopedic team will guide you every step of the way through this. So a good question to ask is, what is the prognosis? So for neurologic scoliosis, like we alluded to earlier, it's as a result of a neuromuscular condition. So based on the neuromuscular condition the child has, that will help you know what the scoliosis will be like as the child is growing. In more severe neurological conditions, the child is more likely to have progression of this deformity, while in maybe the milder kind, the deformity progression may not be as bad. So having that diagnosis and knowing what is leading to scoliosis helps determine what the prognosis looks like. But that aside, talking about quality of life, many children with neurological scoliosis can lead happy and active lives. So the key is early diagnosis and the right care plan. So with regular follow-up, therapy, and sometimes surgery, the curve can be managed well. It's important to remember that scoliosis doesn't define your child. With love, support, and good medical care, they can thrive just like any other child. So here are a few closing tips for parents. One is keep regular checkups, follow the therapy plan, and always ask questions and stay involved. Don't forget to support your child emotionally and in any way that they need support. So thank you for joining us today. I hope you found this video helpful, and I hope you got the information that you needed from it. If you found it useful, please don't forget to leave a like and subscribe and share it with any other parent or anyone else who might need it. And as always, keep it on little growing bonds. Thank you.